Hello guys. So welcome guys. Welcome to the month of Iron Donald, and today I want to discuss something about gynec scan. Right? So we have two types of scan, that is transabdominal scan and transvaginal scan. Today the focus is on transvaginal scan. So here will be the probe marker, and with the probe there will be a marker. And when you see the scan machine, if this is a scan machine, you will be seeing scan machine like this, right? So there will be probe marker at the top, either right or something like this. Probe marker will be there. So how to do TVS, basics of TVS. When you are applying the probe, so you have to apply in a downward direction. If this is a vagina, this is the leg of the patient. So when you are applying, you should apply gently in a downward direction towards the rectum, because vagina is not straight. So you have to apply it gently. So over this probe, you are supposed to use two covers. So take one condom and fill it with gel, then put it over the probe. Again another condom and again fill it with the gel and then put it over the probe. So you have to use two cover, so that gel will facilitate the ultrasound beam to pass, and imaging the structures will be very clear. So this is how you, before doing any TVS procedure, you have to get the consent from the patient and then empty the bladder. This is what is required. Next, so when you are doing TVS, the basic thing what we are supposed to see is, we will see vagina, we will see then cervix, then uterus, then you will see bilateral ovaries. So in uterus and cervix, we have something called anti-flexed uterus, anti-verted uterus, retroflexed cervix, and retroflexed uterus, right? So how to say this? What is called anti-verted? How to know which is anti-version or anti-flexion? See, this is probe. Screen. This is the screen marker, and you are inserting the probe where the probe marker is. Whenever we are inserting downwards, probe marker is facing upward. That is, we are doing in the sagittal plane. When we are doing in the sagittal plane, if you are getting, this is the midline. So this is a cervix anterior lip, cervix posterior lip. There will be vagina. So if you are getting the things uterus like this, if you are getting a picture like this, that means it is anti-flexed, anti-verted uterus. How it is anti-flexed, anti-verted uterus? Because see, either you can think this is a bladder will be there here little amount, or you can think of screen marker. Anything which is towards the screen marker is anti. So it is towards the screen marker, so there is anti-flexed cervix, and the uterus is also towards the screen marker, so this is anti-verted uterus, right? So then coming to the second point, so this is the screen marker, this is the screen marker. So you have inserted the probe with the probe marker upwards. This is the midline. So now you are going to get, instead of that, you are going to get the cervix like this, but uterus will be here towards the probe. So the cervix is away from the probe. That means this is not towards the probe marker. So this is a retroflexed cervix, but anti-verted uterus. Okay. The next condition what we can see is, again, this is the screen probe marker. This is the center. So this is the center. So what we are supposed to see is now the retroflexed and retroverted uterus, retroflexed cervix and retroverted uterus. So this is what is retroflexed. See, this is, instead of this, it will be like this. So this is retroflexed and retroverted uterus. Then the fourth thing is anti-flexed and retroverted uterus, which I didn't say. See, anti-flexed and retroverted uterus. That is flexion, anti-flexion, but retroverted uterus. So it will be like this. So these are the four types how to say anti-version, retroversion, anti-flexion, retroversion in gynec scan. And this is about the TVS for anything related to this. Thank you.